Hello, good morning and welcome everyone. This is the last practical session for the temporomandibular joint histology. I hope you will enjoy. This is a diagrammatic representation starting for the articulation of the temporomandibular joint, showing the mandibular fossa posterior to the articular eminence that articulates with the mandibular condyle. The mandibular condyle is connected to the mandible through the condylar neck. All the articulation, temporomandibular joint, is anterior to the external auditory meatus, which is in the temporal bone. The temporomandibular joint is composed of an articular disc that separates two joint spaces, upper and lower compartments, filled with synovial fluid. The ligaments here are shown. There is a joint capsule, which is too weak to support the mandible but helps in its maintenance in place. There are the main temporomandibular ligament or the lateral ligament and few other accessory ligaments, which are the sphenomandibular, the stylomandibular, the pterygomandibular, and the retinacular ligaments. Here a diagrammatic representation of more closely the articular disc, which is attached anteriorly to the articular eminence and the mandibular condyle, and posteriorly attached to the capsular ligament. Both articular surfaces are layered by a thin fibrous layer. A sagittal section through a magnified view of the temporomandibular joint. The articular surfaces, the articular eminence, and the condyle are lined with fibrous tissue, as well as the articular disc, which is made of dense fibrous tissue, separating synovial cavity into upper and lower spaces. The articular disc is lined internally by a membrane, synovial membrane, which secretes the fluid. Underneath you see the bony tissue, compact bony tissue in the condyle, and the cancellous or spongy in the articular eminence.